How close are we to detecting cancer early enough to make a real difference, without the need for expensive and time-consuming tests? The race to detect cancer early has intensified, with researchers around the world looking for rapid, accessible, and low-cost methods. In recent years, imaging techniques such as CT and MRI have become essential tools for identifying even the smallest tumors. However, these tests can be cumbersome and expensive, requiring specialized equipment and trained personnel, which limits their accessibility, especially in areas with limited resources. So, is there a better way to diagnose cancer earlier and more efficiently? A promising discovery comes from researchers at the University of Texas at El Paso, UTEP, who have developed a compact, inexpensive device capable of detecting specific types of cancer in less than an hour. This device works by analyzing a simple blood sample for cancer-specific biomarkers, which are small molecules released by tumors that signal the presence of the disease in its early stages. If widely adopted, this tool could change the landscape of cancer diagnosis, especially in developing regions where access to diagnostic tools is limited. Let's dive deeper into how this device works, its benefits, and the possibilities it holds for the future of cancer diagnosis. Detecting cancer in its early stages greatly improves a patient's prognosis, offering a better chance of treatment and survival. Studies consistently show that patients diagnosed in the early stages have more treatment options and higher survival rates. However, current diagnostic methods often detect cancer only after symptoms appear, when the disease may already be advanced. Imaging methods such as MRI and CT scans are effective, but they are expensive, time-consuming, and not ideal for regular screening on a large scale or in disadvantaged areas. To address this challenge, researchers have focused on identifying specific biomarkers, proteins, DNA, or other molecules in the blood, that indicate the presence of cancer. Biomarker-based tests are commonly used in clinical practice, such as the enzyme-linked immunosorbent assay, ELISA. Although accurate, ELISA tests require specialized equipment and can take up to 12 hours or more to provide results, making them impractical for rapid, widespread screening. To overcome these limitations, UTEP researchers have developed an innovative portable device that promises faster, more accessible cancer diagnosis. The device is designed specifically to identify colorectal and prostate cancer, and could become a critical component for communities with limited access to medical facilities. How exactly does it work? The device uses microfluidics, an advanced technology that allows small amounts of fluid, such as blood samples, to be manipulated through tiny channels. The patient's blood sample is placed on a special card inside the device, which captures tumor protein biomarkers within minutes, allowing the detection process to begin almost immediately. During the test, the card changes color, indicating the type of cancer detected and its stage of progression based on the intensity of the color. Dr. Xiujun Li, a principal investigator and professor of chemistry at UTEP, points out that this level of accessibility is unprecedented in cancer diagnostics. Detecting cancer biomarkers in the early stages can dramatically improve patient survival, Dr. Li says. Delays in diagnosis, especially in areas without access to advanced technology, can severely impact patient outcomes. This device can effectively fill those gaps. The device is currently being developed for colorectal and prostate cancer, but the research team plans to adapt the technology to other types of tumors. This adaptability could make the device a universal diagnostic tool in the near future, capable of detecting different types of cancer simply by adjusting the biomarkers it analyzes. If larger studies confirm its effectiveness, the eNose could open another avenue for early cancer detection, adding another tool to the diagnostic arsenal. It could enable screening without invasive procedures, reducing the physical and psychological burden on patients and further increasing accessibility. With that said, if you enjoyed the video, please like and subscribe to the channel to stay up to date. Thanks, and until next time.